COVID-19 outbreak and pain. Part 1, chronic pain recommendations. So in this video, we're going to talk about, for chronic pain patients, what do they need to know about the virus, how it affects them, and what can they do to be able to make sure that they are in the best possible health and not susceptible to any issues or problems. Cutting Edge Pain Relief, the channel that teaches you how to biohack your pain and get back to doing what you love. Question of the day. Leave your answers in the comments below. If you have chronic pain, what concerns you most about COVID-19? Is it getting your meds? Is it getting evaluated for imaging? Is it understanding and having a connection with your chronic pain doctor and whose offices are potentially going to close? Is it potentially being able to get surgery if you need it? Is it possibly having an increased risk of infection because you're immunocompromised, either because of pain or buprenorphine? Is it because you are using a fentanyl patch and you may get febrile that you have the possibility of having an increased distribution of your medication? Let us know your concerns in the comments below. The following guidelines were put out by the American Society of Regional Anesthesia, specifically for chronic pain patients. And it's an interesting, unique subset of guidelines that really explain to chronic pain patients what should they do in this time of crisis. As a chronic pain physician that treats both pain patients as well as regenerative medicine patients, we've been looking for an evaluation that's complete and comprehensive, and this is one of those. So one of the things that they talk about is that many chronic pain patients may be elderly and they may have multiple comorbidities, so they can be particularly susceptible to COVID-19. Additionally, opioid therapy can cause some degree of immune suppression, so they should be more cautious and consider themselves as possible individuals who may be more likely to potentially acquire the virus. And finally, the use of steroids in interventional pain procedures may induce immune suppression, which could potentially predispose patients to having being more susceptible to the virus. In the current COVID-19 crisis, healthcare systems have been told to be very exacting with what procedures they do. And the procedures that they should do are urgent procedures as opposed to elective ones. And what has been recommended from ASRA is that elective procedures should be put on hold. The discussion with when they should take place should actually carry out via telemedicine. And each procedure that looks to need to be done urgently should be evaluated on a case-by-case basis. So from a pain standpoint, some of the urgent procedures that exist are intrathecal pump refills, and if there's an intrathecal pump malfunction, it needs to be addressed because it can be life-threatening, or any implanted device that has an infection that is a deep infection and it requires explantation. So the primary one of those would be something like a spinal cord stimulator, but it could be an IT pump. Depending on the type and what's in place, it could be a peripheral nerve stimulator. It's a possibility that it could be something that's like an interspinous spacer device for the element of spinal stenosis. However, that's not quite as common. So any type of implantable device that has an infection or intrathecal pump is a possibility for a need for explant, and that's an urgent indication. Semi-urgent procedures include intractable cancer pain, acute herpes zoster, which is caused by the chickenpox virus or varicella zoster virus, acute herniated disc, either in the neck or the lumbar spine, that could potentially result in loss of limb function that needs to be addressed sooner than later. Intractable trigeminal neuralgia, which is the trigeminal nerve that has severe intense burning pain that's associated with it. Complex regional pain syndrome, also known as reflex sympathetic dystrophy or causalgia, that is imbalance of the nervous system that is severe in nature and is difficult to be able to get back to low pain levels if it's not intervened upon urgently. Acute cluster headaches and other intractable headaches that can cause severe debilitating conditions. And then finally, other intractable medically persistent pain syndromes that just are debilitating and prevent traditional functioning and acute activities of daily living. Things to be considered in this context are also opioids. So opioids in the current COVID-19 crisis, you can use telemedicine as a physician and other healthcare providers to be able to evaluate and continue opioid prescribing. There, there needs to be clear, conscious thought about making sure a prescription is able to be provided so that individuals don't go through acute withdrawal. That naloxone is still provided to be able to prevent overdosing risk for high-risk patients, and the DEA registered practitioners can prescribe patients, particularly via telemedicine, if it's for legitimate medical purposes, if there is an audio-visual, real-time two-way communication, meaning like FaceTime, like Zoom, but traditionally HIPAA appropriate. It can't just be via the aspect of a phone call. And it has to be in accordance with federal and state laws. Steroids. Steroids increase the potential for adrenal insufficiency and altered immune response. Joints injected with corticosteroids have been shown to have a correlation with a higher risk for influenza. Hence, there's some concerns about whether injections of steroids may increase the risk for the viral infection of COVID-19. Because the duration of immune suppression is typically less, there are some recommendations of specific types of steroids. And the specific ones are things like dexamethasone and betamethasone if an injection is necessary. So there needs to be a balance of understanding the aspect of dose with high risk in terms of stratifying the patient population. So if you have diabetes and high blood pressure and you have chronic pain, it's a possibility that doing a steroid injection at this point in time would not be a wise choice. Quick rundown for our pain patients about what they should do during this crisis of COVID-19. What are some of the other things that we're going to talk about? Stay tuned for part 2, which is going to talk about non-steroidal, so things like ibuprofen, Aleve, aspirin, and Tylenol, and how they fit, because there are some rumors and some statements that have said it's good versus bad. And then finally, in part 3, we're going to talk about herbal supplements, what herbs to use, what herbs not to use. Thank you so much for your attention. Be safe and have a great day.